Okay guys, today I am going to go over what we do with under 65 clients and why we started servicing under 65 clients and what we've learned so far in that process, how to make that market profitable, but not just that, how to use it to feed the primary focus of our business, which has always been Medicare and annuities. So stay tuned for that. It's going to be a big one. A lot of people are already interested in it, and I am long overdue putting out a really good all-in-one inclusive training for it. So talk to you here in a minute after my little intro video. All right, guys. First thing I want to go over is how we help people under 65 with health insurance. So we'll look at health insurance in its entirety for the individual market. First of all, we currently don't get into group health. It's just not, it takes a lot of time away from our business model, which is the individual, focused on the individual. So we don't do anything with that. But we do get into several different facets or plans within the individual market. Now, I don't know why I have this really smell the fart acting picture of me on my Health Sherpa account, but we start with ACA. We lead with the Affordable Care Act plans first, because if that is a good option for someone, for instance, if it is a person who qualifies for a low-cost plan, for that might be the best option for them. If not, we at least want to eliminate that first or give them that option and have them turn it down. Well, one way we do this is using Health Sherpa. We really like Health Sherpa because it's just an easy software to use to compare those really quick, and it has a CRM built into it to keep up with, if you will, the health insurance enrollees that we do enroll into an ACA plan. So first thing I'm going to do is show you how to do that, and I'm going to create a couple of scenarios that would rule out some of these people from ACA, and a couple, or one at least, where it would be a good option, and then show you where we go from there. Okay, so ACA is really easy with Health Sherpa. First of all, to get an account on here, I'll have a link in the description of the video where you can actually go and get an account through us. And if you are not contracted with an ACA plan like Ambetter, Oscar Health, Molina, Blue Crosses in certain states, whoever's doing these in the states, if you're not contracted to sell them, that's fine. This software will pay you a referral fee. You can get contracted to some of those. Some of those companies are a little different to get contracted with. It's not just anybody can give you a contract. But the ones that we're contracted with that we actually sell are Ambetter and Molina. They pay us per member per month, typically somewhere between $12 and $20 per member per month. You can get paid for those, depending on the level you're at or who you have the contract through. So anyway, I'm going to start with putting in a zip code here, just to give you guys a scenario. So we're looking at Lee County. I'm going to look at a household of 4 with an income of $150,000. I know we're not always talking to people with this, but I want to create some different scenarios for you. When I do this, I'm going to say that I am applying for coverage for all of them. So I'm going to do the spouse and 2 children. And we're going to say we're dealing with a 40-year-old, a 38-year-old wife, and they're both parents of children under 19, so we're going to get a 15-year-old boy and a 12-year-old girl. None of them use tobacco, and these are the plans we're looking at. These are Molina. I'm not sure why the emblem's not coming up, but you got Molina and Ambetter coming up here. And you can see that they're very pricey. Okay, so this is a scenario where we would probably show this to someone and then give them another option. Okay, I would immediately pivot personally to short-term medical and indemnity health options. The short-term medical that we would pivot to in this scenario would be the National General Short-Term Medical. And I did the wrong thing there. I go here and I'm going to pull it up here. So let's go to my National General Short-Term Medical. And I'm kind of run the same family. Okay. Let's see. So first of all, with short-term major medical, you're not looking at income. So that's kind of nice. A lot of people like that. They don't really want to deal with the income parameters anyway. A lot of self-employed people can't really predict their income. So let's do, let's see, I said 40. So 127, 1979. Is that right? Then we're going to do 38. So 127, 1981. And then I'm going to do the boy. What ages did I say before? 15 and 12? Okay. Just do 127, 19, 15, 19, or 2004. Sorry. And then I'm going to do the girl at 127. Yep, they're all born on the same exact day. Wouldn't you know it? I'm going to do 2007. Okay. That makes them all that age right now. Say we're looking at January 1st, 2020 start dates. Now, different states are different with these short-term medical laws. So most of this is going to pertain to marketing in the states that we market in. Right now, you can do a 3-year renewal option. So you can do a fixed premium, 2 guaranteed renewals of 12 months. That gives you 36 months coverage on a short-term medical. This is new. You know, when we started doing this, it was 4x3s or 3 months at a time. It was not a good short-term medical market. We were doing a lot more fixed indemnity products. Now the short-term medical market is pretty good, so they do make you select relationships. Okay, so we'll still say no tobacco, and let's go into a 3-year fixed option so you can see what those premiums would look like. Okay, it comes to this page and it creates a package for the state room. We always say customize, so we go away from that. And we're going to look at the different options here. There's a lot to look at. These are the short-term medical options for these 3-year fixed rates. So the first one that we like to look at is the lowest deductible, 100% paid after the $2,500 is $780.84. So that's the most expensive option. Now let's go back here and look at what we were facing. The cheapest Obamacare option for this family, $1,322 with a $7,100 individual deductible, $14,200 family deductible. That's just crazy. $8,150. That is the cheapest one, $1,322. This one with a $2,500 deductible, $780.84 for the whole family, 100% coverage up to $1 million per person after the deductibles met, $1 million per year per person. So pretty good option. A lot of these people, when they're facing this looks pretty good. Some of them want to get the premium even lower. If we're looking at lower ones, you can go down to $5,000, 100% after that. You can even get in here and do like $2,500 with a $5,000 out of pocket after the deductible with 80/20 in between, 100% after this $5,000 after deductibles met, $594. You can get down into a copay plan. So these are higher deductibles, $8,000, no charge after the deductible, but with a $40 primary, $60 specialist copay, and $10 drug copay. So it has a drug plan in it. Drug plans are limited benefits on the drugs, so I typically caution people away from worrying with the drug coverage. Normally, if they don't have a prescription drug plan of any sort, if they do get on some sort of crazy expensive medication, there are workarounds like dealing with the pharmaceutical company, and the majority of drugs that they would be prescribed would be relatively inexpensive. So to go with this plan, over, say, a $5,000 one, to spend that extra money for that little bit of drug coverage they do give you and the copay and raising the deductible up. Doesn't make sense to me, but I have had some that really wanted the copay and the drug plan. They're just really fixated on that, and these are options for them. You could even go all the way down to $10,000 deductibles, $347.86, and all the way down to a $25,000. Sometimes people put a plan like this or this with another plan that we have called the Manhattan Life Affordable Choice Plan. Okay, so let's look at the Affordable Choice option. The Affordable Choice option is another alternative to this, or can be paired with a short-term medical. Okay, so let's do this here, 38801. And next, let's build the same family, 1979. The wife would be 1981. Let's do the son's birthday was 2004, and then the daughter at 7. Got to click that add to have it in there. You can leave this one blank, select products, moving forward into the application process. So we're going to click the Affordable Choice Plan and go typically at least Elite. I'll explain. If you look in your brochure, you can see what these benefits look like. This is a fixed indemnity plan, meaning every billing code that is filed on the plan has a fixed amount that it will pay out, but it's a very rich in benefits plan. So you have, in the majority of states, the Classic, Classic Plus, Elite, Elite Plus. So we stay right in here in the Elite and Elite Plus most of the time. Sometimes people with Obamacare will pair like a Classic plan with it, something like that. But with this Elite plan, you're going to have a benefit of $5,000 first night in the hospital. That's $3,000 daily, $2,000 confinement, and a $3,000 per day inpatient stay after that. And that is up to $1 million per year in hospitalization. Okay, it's a $5 million lifetime maximum payout. The Elite Plus is $8,000 the first day, $5,000 a day after that. And some of the other benefits in here is on surgery. They'll have a surgical fee schedule, which is adopted from the Medicare physician's fee schedule for surgeries. They will pay 3 times that on the Elite Plus, 2.5 times that on the Elite. They also have some ambulatory surgical benefits, and then they pay additional bonuses on there for the assistant surgeon's benefit and the anesthesiologist. You have doctor's office benefits, daily prescription benefits, preventative service benefits, lab work, therapy, radiology tests, all that kind of stuff. Okay, now the reason I'm showing you this is so you can kind of get a feel on it. But if you write that with a $10,000, like say a $10,000, where is it? Deductible plan like this, $347.86 plus the $508, your premium still about $855 a month, which is a lot less than these plans over here. And really, you have first dollar coverage with your Affordable Choice, paying on the majority of stuff right away. You have a $10,000 short-term medical there for kind of like a safety net that a lot of people use. And those two plans together are amazing, okay? That's something we do a lot of. We do have some people that will just get the Elite or the Elite Plus by itself. So there is the potential of that. We do like to have them paired, or we lead with short-term medical because it has the kind of catch-me-all safety net concept built into it. But then there's also the skeptics that say the short-term medicals can expire and you don't have any additional coverage, whereas these plans are guaranteed renewable until they get Medicare. So, some people would say you get on a short-term medical, it expires all of a sudden, you're screwed. But if you had the elite plan, you'd have coverage ongoing with guaranteed renewability in it. So there is some potential there. Now I'm going to go back a little bit, and let's do a different scenario here. Let's go delete, and let's say we have a household of two, $45,000 income, and we're just going to be applying for the wife. The man's on Medicare, and we're looking at more like somewhere in here. Okay, let's say we have what's a better deductible for this person. So you can get down into the zero deductible, but if you see these, they still have like an $8,150 maximum out of pocket, so not necessarily a great thing. So what we normally do on these is lead in with a lower deductible concept with a copay, or a higher deductible concept with a copay at $232 a month, and then come back over here to Manhattan Life, and let's change out our product. First, let's change my person to delete. Go back to the quote details. Let's put this person's birthday at, what am I doing? 1957. Female. Next. Select products. Okay. So we got this really high deductible, right? $7,100. This is the out-of-pocket protection plan. We're going to change the effective date to January 1st, 2020. We're going to select a daily hospital benefit. These are really relatively inexpensive. They're just the core benefit. And then we're going to put a first hospital admission bonus of $6,350. So if they go into the hospital, pays out $6,350. Boom, that's the majority of the deductible right there. Then you can add an outpatient surgery benefit, $3,000, and an emergency accident rider. It also has a built-in benefit where it pays $50 for 2 doctor's visits. So a little extra kicker there, but $92.35, and you have $3,000 worth of surgery coverage to help there, and a daily hospital benefit, $200. And if you go into the emergency room, it pays an additional $250 for an accident. And then you got the $6,350 kicker for a hospital admission. So this is just the out-of-pocket protection plan, $92.35 on with a $232. Boom, $324.35. Okay. Many different options in here are these combinations. This is kind of our wheelhouse in combinations. We're looking at ACA, we're looking at we're looking at short-term medical options. So you can really mess around with this, but let's go back really quick and do another quote on the short-term medical for this 62-year-old. So let's say 1956. 2020, and let's just give her, see, she's 56, 1956, so she's just going to need it for 2 years. So we're going to do 2 12-month options there, because she'll turn 65 2 years in. No renewal option necessary, just 2 short-term medical terms in a row. Customize. And we're looking at these kind of prices in here. Okay, so let's say you can see these are a lot more expensive for this age group on the short-term medical. So what we end up having a lot of is people in this age group that if they don't qualify, let's say their income was $98,000. And this is going to be $1,000 a month for this plan. They might go for this, so you can quote them this. You can quote them some of these higher deductible options. Sometimes they do. Sometimes that's what they want. Other times they actually look at the affordable choice because it's very competitively priced for their age group. So now that I've changed that, they can get the Elite Plus for $365.82. You could pair it with a $25,000 with the $7,500 additional. This is just a catastrophic thing, $145.90 with this, and you're still coming in a lot cheaper than a plan like this here with the $2,500 deductible. And you're coming in way cheaper than the $1,001. So you get into these three windows here on a health insurance option for somebody. Also, there's some other things to think about. You know, if you're outside of open enrollment, do these people qualify for a special enrollment for Obamacare? Sometimes you can completely rule this out right away. Let's say it's June. Somebody comes to you and they don't have any special enrollment, they haven't been divorced, they haven't lost coverage through anything else, and they just want something to carry them through until January 1st so that you can then in open enrollment maybe enroll them in health insurance plan through the marketplace or something else. So you can write that short-term medical for, say it's in June, we just need it, well, we'll just say it's not going to let me quote it that far out, I don't think. Let's see. No. Okay, let's say they needed it in May, because it'll let me quote it that far out right now. And so they would need 7 months of the plan. Boom, you can quote 7 months of short-term medical options. So we're going to click customize. Must have put the birthday wrong or something. Oh, it just wouldn't let me quote that far out, I guess. Okay, let's just say we'll pretend this is June, and I'm putting January. And let's say they needed 6 months. Female, 1/1/1956, good for the enrollment period, show plans. Customize. Boom, now you got these options in here, okay? Cool little feature that everybody should know too is if you're selling these, you get a 2% bonus on your commission on the short-term medical if you add an ancillary product over $18 a month in value. So say you add this little accident medical expense for $19 a month, you get a little 2% bump on your commission over here. Plus you get commission on that product as well. So that's just something people should know if they're writing it, because instead of writing accident over here, write it over here and you get that. So okay, some other scenarios, okay, that kind of get outside the norm. Say we're dealing with health issues, okay? First thing you should know, diabetes on short-term medical, at all, complete knockout. No diabetes, no pre-diabetes either. Anybody that says, oh, I just got pre-diabetes, can't write on this. So they're just strict on it. Height and weight is also kind of strict on it. You got some height and weight strict requirements. 300 for men, 250 for women. They have that's how it used to be. Now they do have an actual height and weight thing in here. It's not just the hard 300. There were some men that were like 6'11", I wrote, that were going to be over 300, and I was like, why in the heck would you guys decline this guy? 300's adequate for somebody that tall. But if you have a diabetic and they're outside of enrollment period to get the Affordable Care Act, you need to get them coverage. Manhattan Life may be something you have to pivot to, but they can also be a little strict on that stuff. They will take diabetes, but you virtually have to be very minor, under control, kind of like MedSup underwriting for diabetes a lot of times, maybe even a little harsher. They do have a little strictness there. So we have an underwriting backup that we pivot to occasionally through Philadelphia American. Philadelphia American will take some of the cases that the others don't, and they'll do it on a rate-up system. And they have a brand new e-app that's like similar to Manhattan, so it's been a good little electronic application. So go in here. And boom, let's see, 38801, new app, lead, submit. So, let's just do one for that same lady, 1956, female. Let's say she's got diabetes. When we look at the under 65 underwriting guide, we're going to see diabetes. So you can download this in PDF and just look at it, but if you go down to these conditions, you can get down to just general diabetes as a condition. It's in alphabetical order here, so I'll tell you how many points to rate it. Diabetes. Insulin dependent is a decline. Juvenile onset is a decline. But non-insulin and diagnosed after age 35 is 2 points. This is the majority. So we're going to give them 2 points, okay? And, by the way, Philadelphia American does have group options. Again, we're not really in that market, but if you had group, there are some group options there. Another thing they have is they have a short-term medical wrap. You can just add in that $25,000 short-term medical and write it with the fixed indemnity product. So let's do this. HSP3 Gold. Very similar to the affordable choice options, but with Philadelphia American, you got some flexibility here. You can pick a deductible on here. So you can say I want $1 million calendar year benefit, and they sell it in units. 3 units is the max benefit plan. And when you throw that in there, let's click to continue. I got to click a deductible. Okay, so let's do the lowest deductible. So this is highest benefit, lowest deductible. Pretty expensive, especially with those two points for diabetes. So let's say we want to get it down, maybe $1,000 deductible, maybe $5,000. You see how it comes down there, $2,500. Okay, so let's say a $2,500 deductible, $1 million benefit, and let's go 2 units. So you say, what are these units? What do the units mean? Well, let's look right here for sure. In their plan, you have 1 unit, 2 unit, 3 unit. Okay, so this is your per day benefit. It's kind of like how with the affordable choice, you had the Elite Plus, Elite, Classic, Plus, Classic. Okay, so this one you got units. 3 units would be like your Elite Plus. Some big per day benefits. All right, so if you go down to 2 units, you're looking at these daily hospital benefits, daily ICU benefits, daily mental illness or dependency and indemnity benefits. That's pretty unique. There's a lot of different stuff in there, okay? There are a lot of these indemnity plans out there that really suck, okay? These, as far as indemnity policies go, between Manhattan Life and the Philadelphia American, are the top of the line. They're better than United Healthcare's Health Protector Guard, in my opinion. They're better than National General's Foundation Health. They are the best indemnity products. If you look, also, you can have this 2 unit, $2,500, and then like I was saying earlier, you can add the short-term medical wrap right there within it. Give yourself a full year for that extra $196. So this is like an underwriting backup. I use this when there's no other option. Our agents all use it when it's the last straw. After that, there's most states not a lot of GI options anymore that we really focus on. Normally we can fit them into one of these, and if we can't help them, we try to pivot to critical illness or something that we can write, and then try to enroll them in Obamacare in the annual enrollment period of the open enrollment period. So put it on our calendar to go there and then. But those 4 things will get you pretty far. All of these too, we recommend cancer policies with almost all of them. So when you're going into Manhattan Life and we call it bundling, or I didn't come up with that, actually Galen Hendricks did, the bundling, but bundling health products, when you go through here, you're going to so we're bundling the affordable choice Elite Plus, 911, turn the product list. Now we're going to add first occurrence cancer. So we want to add a $20,000 cancer benefit to that. So if they're diagnosed with cancer, they get $20,000. The policy itself has a chemo and radiation benefit and surgery for cancer benefits, but it's limited. So you have your $2,000 a day up to 40 days radiation, chemotherapy, and immunotherapy benefit built into it. But you can add a cancer policy for that, or you can go over to Mutual of Omaha or Aetna and also write their cancer policy. Is a little bit cheaper. Some people write it directly in here though, because it's all in one platform. You can go in here, you can add a little accident policy, you can add your dental, vision, and hearing right here. Let's add dental, vision, and hearing for this person. And we can add the out-of-pocket protection plan like we were doing with the Obamacare earlier. Over to that. Let's give them the big benefits, everything. Boom, now you got this bundle with the Affordable Choice Elite Plus, cancer first occurrence benefit, dental, vision, and hearing, and the out-of-pocket protection plan, $555.50 a month. Remember, this person's Obamacare premium was $1,001 a month for this person. Now, of course, you throw in here $35,000 income, and she's in open enrollment. It's a whole different story. Say $28,000. You know, it's a different scenario. But even on these, where they're getting these really low cost plans, sell them the out-of-pocket protection plan to cover that out-of-pocket max. Sell them, dental, vision, and hearing, cancer policies, and you can still make this an extremely profitable niche. Okay, so I think we've gone over the how-to in the under 65 market. It's just pivoting depending on what it is. There is no one-size-fits-all product. Anybody that tells you there is not actually out in the market having to deal with all these different people. We have to pivot in these different ways. So I would get set up with these carriers. Now everybody wants to go get the Ambetter and the Molina first. I would recommend having the Manhattan Life and National General first. I was selling those products in Philadelphia American before I could sell the Obamacare, okay? And I would just enroll the Obamacare for free and cross-sell with it and made it plenty profitable. I mean, a typical person selling Obamacare with a, $50,000 cancer policy, well, let's just say the out-of-pocket protection plan that we were talking about earlier at 92, you're talking about $386 there. Then you sell a dental policy and make another $200. You make $586 first year plus renewals with that person. And also, guess what? They're 62. Now they're in your Medicare pipeline. So at minimum, you're making that. Once you get the Ambetter, and let's say it's $18 per member per month, and that's just one person you wrote, that's another $216 there. So you can make $766 off that one lady first year. Now let's say you wrote her the short-term medical option that was $770 a month, the $2,500 deductible. Well, I'm using street-level commissions here, but first-year commission on that's $1,848. So there's large money to be made there. If you're looking at the Affordable Choice Elite Plus option, you're talking about $365. Just that one, you're talking somewhere around $1,226. So there's big money to be made in that with cross-selling, with alternative selling, all of those types of options. Huge potential there. But not just the money on those products is not the only why to do these things. It's the servicing your client base. It's the how many husbands are you going to be able to get because you were able to help with the wife's health insurance as well. How many of these people continue working because they don't know what their options are on health insurance? How many people can you write their health insurance that would have went to somebody else for the Medicare, some call center that's only focusing on the Medicare supplements because they're wanting the easy money, and they're not focusing on helping them with their health insurance needs? We're getting so many people that are on our books for health insurance age in now. We're getting so many people come to us for health insurance when they retire at 62, 63, 64. Then we're getting the Medicare supplement for the spouse. Sometimes they have a spouse that's already on Medicare and they got their supplement somewhere else. We're getting them that way. So many opportunities there that we're completely overlooking if you're not servicing this niche. It is huge, and most people don't want to help with it, or they do a terrible job and they don't want to give them all their options. They don't want to give them the ACA option, or they don't want to give them the short-term medical, or they don't want to give them the indemnity option, or they don't want to combine it and get creative for them, or as soon as they can't get them approved through underwriting, they ditch them somewhere else, or they are a company that touts their PPO and doesn't tell you that really the plan sucks and has no coverage for surgery, because there's a lot of those out there. I won't name any names, but a lot of them are out there, don't even tell the clients that there's no coverage for surgery until they have a pending surgery. I don't even understand how they're getting away with it. But anyway, it's a great niche, and I did this training for free because I want to train people to do it, and I want more people to be able to service the market, help more people, and I enjoy helping agents grow. I would hope that if this is helpful to you and that you're getting more training and advice from me than you are some upline, that you would allow us to help you contract for companies like Manhattan Life, National General, and Philadelphia American, Aetna, Mutual of Omaha, any that you don't already have, or even some that you do have that you're not getting support that you need. We have the levels to give you the same commission level or higher than you're already getting. Whatever you deserve. We're very fair with it. We give training and results first. We're not giving away a bunch of free leads, but if you have some upline that's already giving you tons of free leads that you find valuable, I wouldn't move anyway. So just wanted to put this together as a way to say there's a huge opportunity out there. I know a lot of you are missing it. Any questions that come up from this, please put them in the comment section on YouTube. The comment section on YouTube is a great place for us to answer them, and where other people can find those same answers, and that way the questions aren't asked multiple times. If you're not in Medicare Gurus and you're just now finding this YouTube video, head over to Facebook and join our group, Medicare Gurus, and please, 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 please subscribe to this YouTube channel, as I will do my best to put out more content and help all of you grow. So thanks, guys. Talk to you soon. Merry Christmas. Happy New Year. See you soon.